Hello everyone! Today I'm going to share with you a detailed procedure I performed in my office. If you're here because you suffer from ingrown toenails, onychocriptosis, or even granulomas, know that I understand exactly what you're going through. Let's go through this procedure together. I'll explain everything I'm doing step by step so you can understand how we help our patients relieve pain and promote foot health. Now, as I take care of my patient's foot, I'll describe exactly what I'm doing. I started by observing her case. She told me she had a hard hit, probably from kicking something, and that ended up worsening an already weakened toenail. I noticed the nail was cracked with a loose and hollow part, which was causing a lot of pain, especially when she moved her foot or pressed on the area. This type of situation is typical of onychocriptosis, where the nail grows improperly and ends up penetrating the skin, causing inflammation, pain, and in some cases, even a granuloma, that red, sensitive tissue that appears as the body's reaction. First, I applied a local anesthetic because the patient was in a lot of pain. As you already know, I always use anesthetic medication during procedures to ensure the person doesn't feel discomfort throughout the process. While the medication was taking effect, I held her foot carefully, keeping it steady but without causing more pain. The loose part of the nail was clearly inflamed, and every time she moved, she felt a strong discomfort. So, with a sterilized tweezer and specialized podiatry instruments, I began to assess the extent of the damage. With great care, I held the loose part of the nail and gave it a small tug to check how far it was disconnected from the nail bed. That's when I realized the hit had caused significant trauma. The nail wasn't just cracked, it had also detached from its base, pulling the surrounding flesh and causing even more inflammation. At that moment, I decided the best course of action was to cut only the loose and damaged part to immediately relieve the pressure and pain. I used a specific podiatry scissors, sterilized, and cut slowly with precise movements to avoid any additional damage to the nail bed, which was already very sensitive. While cutting, I explained to the patient that the pain she was feeling was normal because the area was inflamed and the movement of the loose nail was irritating the surrounding tissue. After removing the loose part, I cleaned the area with an antiseptic solution to prevent infections, since any open wound is susceptible to contamination. I also noticed there was a small granuloma starting to form, probably due to the constant pressure and the body's attempt to protect the area. For that, I applied a specific medication that helps reduce inflammation and promotes healing. After cutting and cleaning, I made a dressing with sterilized gauze and a bit of healing ointment. I explained to the patient that this dressing needs to be changed regularly and that she should come back in 2 or 3 days for a follow-up evaluation. During that return visit, we'll check how the nail bed is responding and, if necessary, make adjustments to the treatment. The goal is that in about 2 to 3 weeks, the skin around the nail starts to regenerate and the pain decreases significantly. While I perform this procedure, my main focus is the patient's well-being. I know how painful and inconvenient an ingrown toenail can be, impacting even simple daily activities like walking or putting on shoes. That's why I always try to be as gentle as possible, explaining each step and ensuring the person feels safe and comfortable. In this specific case, I noticed how distressed the patient was about the pain and the trauma from the hit, so I made sure to reassure her, saying we're on the right track to solve the problem and that she'll feel relief soon. It's also important to remember that many people, when facing this type of issue, end up trying to fix it at home or even going to urgent care centers or hospitals where they don't always get the specialized care they need. As a podiatrist, my role is to offer professional, safe, and effective treatment, preventing bigger complications like infections or permanent damage. If you're watching and suffer from ingrown toenails, know that you're not alone, and seeking help from a professional is the first step to feeling better. So, everyone, where are you watching from today? I'm curious to know if you're from a specific city in Brazil, another country, or maybe even somewhere here in the US. Leave a comment letting me know where you're tuning in from and if you've ever had a problem similar to my patient's eye. I love interacting with you and learning more about your experiences. Now, a quick tip for those dealing with ingrown toenails. Avoid wearing shoes that are too tight or that press on your toes because that can worsen the problem. It's also important to keep your feet always clean and dry and never try to cut the nail at home in an improper way because that can make things worse. If you notice signs of inflammation, like redness, swelling, or pus, see a podiatrist immediately. Another important thing to watch out for is whether you have a habit of using antifungal creams or other medications without guidance. Because, as we saw with my patient, that can mask underlying issues and lead to complications. Guys, before we wrap up, I have a special request. If you like this video and think it can help other people facing similar issues, give it a thumbs up. This is super important to me because about 90% of the people watching my YouTube videos don't follow me yet. When you like, comment, and subscribe, you're helping show YouTube that my content is valuable and not low quality. So don't forget to subscribe to the channel, turn on the notification bell so you don't miss any videos, and share this content with anyone you think might need it. Let's spread information and foot care together. To close, I want to leave you with a message. Taking care of your feet isn't just about aesthetics, it's a way of taking care of yourself, valuing your health and well-being. Every step we take in life depends on our feet, and they deserve all the attention and care. If you're facing a problem like an ingrown toenail, don't give up, seek help, be patient during the recovery process, and believe that with the right care, you'll be walking comfortably and confidently again. Until the next video, take good care of yourselves and keep following our work here on the channel.